Hi everyone, my name is Baljot, and today I'm going to be talking about my SWEP or Summer Work Experience Program internship experience. To start, I'm a second year MPH student at UC Irvine, and I learned about SWEP through UCGHI. And my specific program was focusing on nutrition, and I was working with faculty from UC Berkeley, whose research interests are in nutrition and how it relates to the onset of disease, as well as how it focuses on maternal and child relationships, as well as child development. And so over the summer, we were focusing on understanding how breastfeeding is a good alternative to infant formula and how physicians nowadays should be aiming to educate their patients on promoting breastfeeding instead of just telling them to go on to formula. And this was really helpful as it really opened up my perspectives to the importance of nutrition and just learning more about breastfeeding culture, as there was a lot I didn't know about. And as someone who's interested in working in public health, this was very big to help prepare me for careers that I'm potentially interested in, as I was interested in learning about nutrition, but I didn't know how early it starts, which is, during breastfeeding, during the first few weeks of life. And I was really grateful for this experience, for exposing me to that, as well as preparing me with the skill sets needed to work in the field for this. I will be sharing some resources that I was able to create during my internship experience. Just give me 1 second. All right. Here we go. So yes, this is my experience. So I was able to create infographics that help compare breast milk to formula, and just kind of comparing how breast milk will have more bioactive components. It will help with immune protection and help protect the baby, as well as set the baby up for better health. And so it was shown that babies who are breastfed longer will have a lower risk of developing type 2 diabetes, type 1 diabetes, obesity, and they will have a better relationship with food versus infants that are put on formula early on. And so we're also able to create this infographic here, which kind of shows the positive feedback loop of milk production. And so we wanted to show that it's really important to have representation in our media. And so we're aiming to use these infographics and kind of use all the resources that were created in this internship program to educate physicians and do trainings to train physicians about educating their patients and how to formulate those patient interactions. And again, this is another chart that goes over the differences between infant formula and breast milk. And then there's also notes like if something's showing up in breast milk that's not in formula and how it compares. And then we're also able to, so I was able to go and kind of see what physicians are being trained on right now. These are two different modules. One is through the American Academy of Pediatrics, and the other is the Academy of Breastfeeding Medicine. And it's kind of just going over to see what physicians are currently being trained about and how we can help promote breastfeeding and kind of filling in the gaps with these trainings. I was also able to create this presentation that goes on different cultural perspectives on breastfeeding. This helps better understand patients that will be coming in, what background they're in, what their culture already talks about on breastfeeding. So this is one example with the Latinx community, African American community, Native and Indigenous communities, and then the the Asian, Native, Hawaiian, and Pacific Islander communities. And these are the references that were used. So we made sure to use credible research studies only to get our information and to look at, cultural humility to make sure that everything that was being produced was meaningful and it had a scientific background to back it up. Thank you. Okay.